how do we know if someone's had it? So, got to keep your eyes peeled. The best thing you can do is to actually, as either a parent, a coach, a ref, is to take the CDC's, the Center for Disease Control, has a little unit that you can take online called Heads Up.
Okay.
It's a fabulous educational program that it's almost really required by a lot of youth sports organizations for folks to take, but it actually helps you learn the signs and symptoms of concussion, which are, headache and wooziness and all that other stuff. Um, on the field, as far as on field recognition, there are a couple of forms that can be used. And so there's the Sports Concussion Assessment Tool 5, or the SCAT 5, which is used when you actually have a medical professional at the ready. If you don't have a medical professional at the field, which is okay, you can't expect that to happen all the time, you would use the CRT, or the Concussion Recognition Tool. They're related,
Yeah.
but literally the difference is that you either have a medical professional there or not. The idea behind it is that there's an on-field, like, sideline assessment component, and you're trying to, like, rule out badness. Does this person need to go to the emergency room, like, right now? Do they have, like, loss of consciousness, or is there, like, an actual traumatic, like, open head wound? Or if you see any of that stuff, you send them. They go to the ER after you've gone through, like, the on-field assessment, which it'll walk you through it. It's kind of like having an AED, or the device available at school if
Right.
someone has a cardiac event. It'll actually tell you what to do. This you just read. All right, this step one, this is step two. Depending on where you are on that, then you can go through the workflow. Um, Once you determine that the patient or young athlete doesn't need to go to the ER, and they can actually, like, you can take them aside, you would take them to a quiet area and complete the rest of the form. So
Mm.
that's the off-field assessment that could have a medical professional or not there. Either way, you're going to want to see the doctor within 24 hours.